I mean, we're building, I think, pretty much hands down the best system in the world. It will support the accuracy, it will support the precision, it will support that multifocal targeting.
That's Jeff Coull, the founder and CEO of Grey Matter Neurosciences, the company that has been making headlines for their unique treatment for aging-related brain diseases.
We develop medical devices and drug device combinations that exploit a unique focused ultrasound technology.
The device is a helmet that uses focused ultrasound beams that converge to create small pockets of pressure within the brain. Unlike electromagnetic stimulation, sound waves are hardly disruptive to fragile tissue. The changes in pressure and thus temperature, a reference to the ideal gas law, can excite neurons with pinpoint accuracy. With new patterns of excitement, new synapses and connections begin to emerge. Over time, these minute tweaks can lead to better mood, brain function, and even memory. But Grey Matter intends to excite more than just neurons. Although only founded in 2024, Grey Matter has already received a $14 million round of seed funding and currently employs over a dozen scientists and engineers. Now, how did a company like this get started, and what inspired a neurologist to go into building helmets?
I'm a neurophysiologist by training, and specifically an electrophysiologist. And I often thought to myself, if only we could stimulate the brain in deep structures, wouldn't that be powerful? That's what's really unique about focused ultrasound is the fact that you can penetrate to anywhere in the brain.
Not only is this technology revolutionary for its functionality, but also for its ease of use. Patients will receive a brain scan and then have that scan uploaded to the device. Since the device can function without constant updates, the treatment can be given at the doctor's office or even at home without requiring more brain scans. The young company has yet to push the therapy through clinical trials, and no device is approved to even be evaluated at the moment. Although this device may be exciting, more evidence demonstrating the effects of the device must be seen. As is the case with many treatments that seem too good to be true, they often are. Lucky for us, Jeff had an example of where similar tech has already been shown to work.
In glutamatergic signaling, there's a phenomenon called long-term potentiation. And there's some pretty good evidence that low intensity focused ultrasound, if you direct it there with the right patterns, you can cause a very rapid reorganization of those synapses and therefore strengthen that long-term potentiation. And if you strengthen long-term potentiation, then you can also strengthen memory.
So, if promises are kept, a better memory, stronger cognition, and even a better mood. So why are we limiting this technology as a treatment for deteriorating minds and not improving the brain power of people everywhere?
Our goal, at least right now, is really to evoke cognitive enhancement. And so if there is no cognitive decline, then there is no indication for the device.
As diseases like Alzheimer's and dementia affect millions of elderly men and women worldwide, Grey Matter must act quickly to test and produce its technology. Grey Matter is confident in their funding, despite the large loss of funding to the scientific community and the possible tariffs placed on their product. Now they look forward to beginning their clinical trials.
So we're hoping to kick off a trial in the next year or two. I mean, we're not planning on running this for months or years. We're really looking for acute effects.
With an ever-increasing susceptible population, companies like Grey Matter stand on the cutting edge of slowing diseases like Alzheimer's and dementia. Without clinical trials, Grey Matter may be viewed as just another wistful thinker. Although the company's future remains uncertain, the facts of aging do not. Thank you for watching.